Welcome back. So we are going to do a kind of lower leg, calf, and shin mobility routine. So we're going to try to go get it done nice and quick. You'll follow along. Want to respect time, so let's get right into it. Equipment you'll need is a foam roller or some other soft tissue implements, whether it's a Theragun, a roller, something like that you can do to initiate the movements to start out with the routine. And then I'm going to use my treadmill. You can use a wall or something just to brace yourself against for the stretch. So mobility, we're going to start with just doing a minute. I'm going to get my watch going so we can hold this accountable, and we'll go. We're just going to do a minute on each leg for some initiating soft tissue work. So we're doing this to help desensitize the tissue so that we can get a little bit bigger stretch through it when we do our wall stretching, right? So from a priority standpoint, the stretch isn't the biggest priority. It's actually making the tissue pliable and desensitizing from a nervous system standpoint to allow us to actually get that stretch. So what I do is I like to put a lot of weight through my leg. You can sit on the ground and just kind of roll back and forth. I do one leg at a time because I want to actually get aggressive within that tissue. And then I kind of work all the way down the Achilles. I roll my foot back and forth. So you can see that I'm working the midline. I'm working inside of the calf. I'm working the outside of the calf and just trying to go back and forth. Don't make it super painful. Yeah, 8 seconds left. Don't make it super painful. It should be comfortable, but it's not like we're trying to quote unquote hurt so good. So let's take a switch. If you're using your foam roller, we'll switch legs. If you're using your Theragun, let's do it every other leg. And we're just trying to roll back and forth. So make sure you explore all regions, the inside, the middle, the outside. Get all the way up into the calf behind the knee, all the way down to the ankle, and just kind of keep the system moving. And after this, we'll put our soft tissue implement aside. We'll go to a wall. I'm going to use my treadmill, and we're just going to do back and forth a calf and a soleus stretch. We're going to kind of work both sides. So educational piece, and we'll have more of this. From a muscle standpoint, there are two muscles. I guess you can count it as three if you count the gastroc as two, but there's two different muscles that make up your calf complex, and we want to make sure that we address both of them from a stretching standpoint. Since the soleus is the muscle group that undergoes, okay, let me put this one aside, undergoes the most amount of load when we run. So I'm going to use my treadmill here. We're going to put one foot back, keep it nice and straight, and then I just kind of lean and push into the treadmill. I'm going to get 30-second hold here. So we're trying to keep that foot nice and straight if we can. Make sure that our heel and our foot are straight going forward. Some people have a tendency to rotate in or out, but let's see if we can keep everything moving forward in that direction. This is going to test some of your ankle range of motion. So if you have limitations there at an ankle standpoint, this is going to be more challenging. We're just trying to keep the tension on for 30 seconds. It's not about how painful and how aggressive we can make it. It's about getting a gentle stretch over a longer period of time. And switch. And you might feel a difference in one side versus the other. That's totally fine. And again, you're not searching for a big, aggressive, irritating stretch like that hurt so good feeling. You're really just trying to get a nice, gentle stretch that we can sustain over a longer duration of time. The longer the hold, the better it's going to be, right? We're trying to creep that tissue further and further apart instead of kind of ripping it like a rubber band where we get that big recoil effect. So 4, 3, 2, 1. Let's do it one more time on each side. So straight leg. And then after this one, we're going to go into our soleus raise, but we'll do 2 sets of 30 seconds on the straight leg calf stretch, 2 legs, 2 times 30 seconds on the bent knee stretch. You might feel some through your hip flexor, and that's okay. On my right side, for example, I am more limited within my hip flexor range of motion than my calf, so I feel a bigger stretch here. And switch. Make sure that that toe and that ankle are going forward. If you rotate your toe in or out, you're going to change that stretch on the calf. So let's just really try to drive everything forward and back. So this will be our last one here. Then we'll switch back to the right side. We'll bend our knee. I'll demo that in 12 seconds. So just hold, apply a little bit of force against the wall, the pillar, the treadmill, whatever you're using. And 5, 4, 3, 2, 1, and now switch back. You're going to bend your knee and keep that foot flat on the ground. So my foot is flat, my toe is forward, my ankle's right behind that toe, my knee is bent, and I'm just driving things forward. So this is going to feel that stretch and address the soleus a little bit more. Lower in the system, deeper in the system. You should feel this a little bit lower in your ankle. Same sort of thing, 30-second stretch, knee bent, feeling that stretch low, keeping that foot flat. If you lift your heel up, that's really gonna limit the stretch. So if you have to, you just step closer to the wall and switch. So knee bent as far as you can while keeping your foot flat, and then just kind of lean in and pushing forward. 30 seconds here as well, trying to address more of that deeper soleus muscle. This is the muscle group that undergoes the most amount of load, primary mover for running. It's our endurance muscle. So we got 12 more seconds here. Then we'll do another set on both sides. So overall, we've done a minute of soft tissue. We're gonna do 2 times 30 seconds on each leg for each movement. And switch back to this one. Knee bent, foot flat, push forward. We'll get 30 seconds. So that's gonna be a minute on each leg, 2 different movements. That's 2 minutes on each leg. We had 3 minutes on each leg if we do the soft tissue, 6 minutes total. And then we're just gonna finish working our ankle in the opposite direction to finish up with more of like 6.5 to 7 minutes for this quick routine. And 8, 7, 6, 5, 4, 3, 2, 1, and rest. A lot of people ask, when should we do these stretching routines? Sorry, you hear my brain click. After your run is going to be the best time to get this stretch in. A prolonged stretch like this actually is going to decrease the muscle performance. So after our run, we can do these more static-based mobility exercises. Before our run, we want to do the warm-up activities, the dynamic movements that we have taught you through those warm-up exercises. 4, 3, 2, 1, and done. So finally, we're going to go on our knees. Feet are going to be flat, and we're going to try to sit down. Some of you might not be able to do this, and that's okay. We're just trying to hold this position, getting a stretch through the front of the shin. So again, get on your knees, not on your toes. Try to put your top of your feet flat on the ground, and then you'll sit backwards and you'll feel that stretch through the front of the leg to the front of the ankle. If this is too aggressive, don't do it. If you need to, offload a little bit and bring your body weight forward, that's totally fine. If you can drop your weight back, that's even better. It's gonna be a little bit more aggressive of a stretch. But remember, we're not trying to stretch till it hurts. We want a gentle stretch. It's not hurt so good. Gentle stretch over time. 1, and that's it. So that's 6.5 minutes of a lower leg routine, soft tissue, some stretching for both the back side and the front of the lower leg, working your gastroc, your soleus, and your anterior tib.